do you think that we should be pushing more health and well-being as well as the vaccine? Or do you think that right now it's more important to talk about the vaccine?
Well, I mean, it feels like a loaded question because the answer is obviously yes. You can't, how
Yeah.
can you speak about health and well-being without talking about health and well-being, right? So having a healthy lifestyle, making sure that you're in shape, all of these things, they're not specific to COVID-19. They're just general to having a healthy lifestyle and being a healthier person, right? If you have a immune system that's already high functioning and your body's not fighting off things like diabetes or emphysema or COPD or anything like that, right? That's more resources to focus on keeping yourself healthy. And that every doctor that I know of in the world is going to tell you that that's a good thing, right?
Hmm.
I can't imagine a single doctor that's like, you should definitely sit on the couch, get to like 500 pounds, eat potato chips, and like you're going to be healthy.
Yeah.
So yeah, that's just a general conversation. I think when it comes to this pandemic, right? The talk is definitely on what can we be doing as preventative treatments. Vaccines are number one. Vaccines are a natural way to protect yourself against a natural infection, right? So it's not like some like crazy medicine like insulin or ibuprofen or something like that. It's a piece of a natural virus that's going to allow your body to do what it's meant to do and generate protection against you. And that's a great way to start protecting yourself. Living a healthy lifestyle, taking your vitamin D, that's also going to help, not as much as a vaccine, because a vaccine is specific to protecting you against coronavirus. But it's going to help you to, even if you do get sick, to hopefully get over these things quicker. The last thing I want to say on that, though, is that I work here at a hospital and I've got a lot of friends who are in the emergency room and see patients on a daily basis. And, you know, we kind of think of this as black and white. It's like people with comorbidities, old people are the ones that are getting really sick. But I hear all these stories and I have pictures in my phones of all of these lungs of young, healthy people who are in their mid 20s to mid 30s who don't have these comorbidities, who are still being hospitalized about this. So it's not like there's a magic number of if you're young and healthy, you're immune to it. You know, you never know if you've got some underlying genetic condition or if you just get a high dose or you get a variant of that virus that came from someone that's going to just put you out. And so why take a risk when you can have an action that protects you, which would be the vaccine?
Has there been any studies on whether the people in the young 20s, when they get something really bad in their lungs, has to do with the vaping epidemic that we're seeing and how,
Uh,
and I don't know if you know that answer, but I was thinking of that when you were talking.
no, that's a great question. I don't have the answer to that. I would love to see the studies that come out on this. Yeah, smoking for what it is it's not great. You don't want to be inhaling anything into your lungs. It affects your cardiovascular system again. Actually, I was just hanging out with my friend who's a urologist last night, and he was talking about this. Again, erectile dysfunction, I feel like, is a way to scare any guy into doing anything.
Yeah, yeah.
Yeah. And so he was telling me about like, so luckily it's like fairly reversible if you, as long as you stop smoking, but like the biggest cause of that in young men right now is smoking. And so and that's because it's breaking down your blood vessels. And so this virus is already attacking your blood vessels. So vaping, smoking, anything that's going to cause damage to your lungs, damage to your heart, damage to your blood vessels is not going to be great. So I imagine when those studies come out, there's probably going to be some correlation, but at this point, that's all speculation.
You know, going off a little digression, I think it's all about habit. You know, everything that we do is about our habits. It's so easy for me to fall into a habit where, especially if I'm not in school or I'm not playing football or I'm not like really engaged in something working, you know, if I'm on vacation or like I have some time to just like relax, it's really easy for me to fall on the couch, eat potato chips, hang out, drink a couple beers every night and not work out or go, you know, do things. But then if I like, all right, I'm going to eat like this and I'm going to start working out. Really, if I start working out and I work out consistently for 2 to 3 weeks, 5 to 7 days a week, because I like playing basketball and stuff. Like I saw your, shout out Kennen, he can dunk. Yeah, I like staying a little active. And if I get in that habit, it's really easy for me to stay in that habit. So I think it's all about, you know, if we could find a way, and now COVID kind of put a little shutdown on going outside and hooping and stuff. But now that everything's opened up and stuff, if we could find a way to get it really instilled in people's minds, just try a habit, a good, healthy habit for a little bit, I feel like it will be easier for people to consistently do it because it is, especially exercise. It's so rewarding to you. If I don't get a workout in when I know I should have worked out, I feel like shit. And I know everyone else feels like that. I bet you do too.
Yeah, yeah. I mean, when I am in a habit of working out, for sure, I feel like guilty when I don't work out. Building habits are hard though. There's a ton of books. There is, what is it, 8 ways to build a habit or something like that. Is like I was just recently reading that, and High Performance Habits was another good book. I don't know. The hardest part about it though is like building that habit, right? You have to have the drive, whether that's internal or external. If you're talking about exercise, to go to the gym or to do your workout every day. And that's just one aspect of it. I think while I'm always going to promote working out and having a healthy lifestyle, sometimes it's hard for people. Like imagine being a single mom who's working 3 jobs in order to make sure that her kids have all the resources to go to school. How do you fit in gym time in there, right?
Yeah.
Or what if you live in a neighborhood where, getting access to the gym isn't necessarily the safest place and you don't have a backyard to run in, or you live here in the city and like there's not a lot of green space for you. So it's easy to be like, yeah, I wish everybody would do this, but you always have to consider like not everybody's as fortunate as us too. And so how can we make building these habits more accessible to everybody?
And, there is something to be said about people who are staying fit, recency bias. If you're going to the gym, working out for an hour to 2 hours a day, lifting heavy ass weights, it will easy for you. Like, why doesn't everyone do this? But I was recently listening to a podcast with Ethan Suplee and Joe Rogan, the dude who was like 500 pounds. He was the dude in, Remember the Titans, who was really fat. And then he got really like jacked, that guy. And he was
Yeah.
talking about, it's all about what you can get yourself to do. If all you can do is get up and go to your car or get up and walk to the mailbox, then that's what you got to do. And so I think, and what I will say that I disagree a little bit what you're saying is like, yeah, a lot of people are fortunate, but I do think that a lot of us, especially in America, now the single mom argument is a very good argument, but I feel like a lot of us have time we can fit in, but we'd rather be comfortable in those times. We wake up, we get in our phone, we lay in our beds for 30 minutes. When all you can do, you do some push-ups or do some squats. Everyone can fit in a little bit of time. And I think that, I'm totally, totally, totally victim of this. It's that when you're comfortable, when you're so comfortable, because our beds are so comfortable, our cars are so comfortable, everything's like, we have Xboxes, we have laptops, when we like allow ourselves to become so comfortable, it's really hard for us to build a habit, like we're saying. And I think that's one of the reasons why building habit is so hard, especially like working out, because does take 30 to an hour. You know what I mean?
Yeah, yeah, for sure. I don't disagree with you there. Yeah.